some of these ideas have come from the teaching opportunities that I've had in an MBA for doctors program, where I had the doctors actually do projects. And they gave me some ideas about the things that they're actually seeing. And so I'm going to talk about two of those. I'm going to be a bit more, I think, a little more granular than some of the other presentations, but I hope that you can see, I think it still fits into the ecosystem we're talking about. The first thing that I've run into when I'm talking with these doctors is that there seem to be biases that are very specific to healthcare choices. And one that has come numerous times has to do with an anti-community bias. Now, if you look at the healthcare literature, you find that outcomes are much better when you are in a hospital that is closer to home. And I think a lot of this has to do with what Irina just talked about with having a relationship. When your doctor is somebody you see at the grocery store, when you can get to your doctor easily, you do see better outcomes for a wide variety of conditions. And for about 20% of the population, this means rural community hospitals. And I went ahead and did a conjoint on this to see what would happen. And what you see is that all else held equal, most people will choose the closer hospital, and moving from 5 miles away to 20 miles away completely inverts the choices that you make. However, there's another knot that gets thrown into this, and it has to do with the type of hospital. Major university hospitals, which many of us will be, in some way affiliated with, do have better outcomes, but only for very specific and often specialized kinds of treatment. For everyday things like hernias, you're just as well at your local community hospital, but people are drawn from the rural areas to these larger, urban, farther away university hospitals because they have a very strong belief that all treatment is better there. And that simply is not the case, right? So you have this really interesting bias that fights with another bias, right? In a way that no one that I can find in healthcare has actually studied. So we need to understand how patients balance these factors, particularly given that the cost pressure on the small community hospitals is intense. They are closing down. This little graph on the right. These things are they're disappearing, and that creates a problem for everyone. First of all, the urban hospitals then have more patients to deal with. Second of all, the care outcomes are worse because it's far away from people's home. And third, people then have no option if they're constricted in their transportation. And so then the question becomes, given these tensions, how do we actually tip the scales toward the kind of provider that is better for the patient and also helps the whole system function? So I think my sense is there are other biases that are specific to care choices that are very loud. These are really loud signals in the data that we can try to understand and ideally help with. Okay, and then if we move to more macro level, I want to talk about some data that is available that I find it very curious that we haven't worked with that much, and that's the HCAHPS data. So when I've done work with hospitals, they all want to know, that's the big question, how do we make our HCAHPS scores better? And the reason they care is that part of their compensation from CNS comes through their HCAHPS score. This data is freely available. It's only about 18 substantive items. There's some other filler questions, and then different hospitals will have custom items that they've added. But they ask things like, how well do you communicate with the doctors, the nurses? How responsive is the staff? How quiet is the environment? How well is pain managed, et cetera, et cetera. And right now, unfortunately, I'm not quite sure why we've not worked with this data, merging it together with other data sets, but I think it's a huge opportunity for us. What you see in the middle panel here is an interesting distribution of responses. What you do find in this data is you don't get extremity bias. And part of the reason I think this happens is that they've studied this survey enough that they do some clever things. For example, they know that phone responses tend to be more positive than online responses. And so they actually adjust these numbers for the mode of delivery. What's also interesting, though, is that not all modes of delivery are available in all languages. So there's some interesting confounds in that data that I really think we could help with. And then in the third panel here, I want to bring out some questions that I think could be answered by looking at this data more carefully. A lot of people have beaten up on the HCAHPS survey because it does include this pain management piece. And I don't know if you guys have read any of the interesting books like Dreamland by Sam Quinones, looking at the opioid crisis. They've said, look, when you tie reimbursement to pain management, there becomes a very strong incentive to just dump opioids on people. Now, some recent research has gone back, looked at age caps, looked at prescriptions of opioids, and said, nah, it's too small a component of the survey to have a very strong effect. But pain, we know, is a weird animal. The way we experience and express pain, the way we remember pain, is something we've actually studied. And so we have something to contribute here in understanding the role that pain does play in a satisfaction score and the role that it could play in a different way. I'll tell you up really quickly. Secondly, not surprisingly, they have looked at our research and they have found that indeed advertising helps for us. They actually cited some of the people on this call in this work, but we haven't talked a lot about what type of advertising, and nor have the hospitals to a large extent. And then finally, because they've analyzed this age caps data so thoroughly, they have found all kinds of biases on it, and we haven't helped. So ideally, love to see us this age caps data and hopefully be able to help out with that.